Well, you might be trying to stay on top of resolutions to eat better and exercise more, all to keep your heart pumping.
Valentine's Day chocolates make it a little difficult, but anchor Susanna Black spoke to a local doctor about how we can keep our hearts healthy.
February is known for the heart. After all, Valentine's Day falls in February, but it's also American Heart Month, and doctors want to make sure that you are keeping heart healthy this month and all year long. Dr. Sandy Charles is a cardiologist with Novant Health, and she joins us here today. Dr. Charles, thank you for being with us.
Thank you for having me.
Yeah, so we hear about heart disease all the time. We know that it's the leading cause of death, but what is it?
Wonderful question. So heart disease is actually an umbrella term, and there are so many different ways that the heart can malfunction, but there are four heart diseases that are particularly prevalent. The first one is something called coronary disease. Coronary heart disease is when the arteries in the heart develop plaque and blockages, and this is the type of heart disease that leads to chest pain and heart attack. The second major type of heart disease is something called congestive heart failure. This is when the pump function of the heart starts malfunctioning, and this can cause a variety of symptoms, usually having fluid buildup in the body. The third major type of heart disease is something called arrhythmias, of which atrial fibrillation is a part of. These are the type of heart diseases where the heart can go really fast and make you feel uncomfortable and give you palpitations, or the heart can go really slow and prevent you from being able to do your routine activities or make you faint. And the fourth type of heart disease is valvular disease. So there are a few valves in the heart, one of which is called the aortic valve, the other is the mitral valve, and they can malfunction and make people feel really sick. So I'm really excited about Heart Month because heart disease is the #1 cause of death for people, killing more people than all forms of cancers combined. So it's a time to raise awareness about heart disease.
Well, thank you. And when we hear about heart attacks, symptoms are not the same for men and for women.
Yes, so for a long time, heart disease was thought to be a man's disease. And when we talk about heart disease as it pertains to the difference between men and women, that's usually referring to coronary artery disease. Frequently, men present with heart attacks, but for women, the symptoms can be much more subtle. And because of that, women have been underdiagnosed, undertreated, and there hasn't been that much research for many years. So for women, instead of having heart attacks, sometimes you can have shortness of breath or just feel like you're not getting enough air in your lungs. Sometimes it could be abdominal pain or indigestion, nausea or vomiting, or sometimes it can be severe fatigue and not knowing why. So if you're having these symptoms as a woman, the important thing is to not ignore it and to really go and get them addressed by a doctor. And at Novant Health, we're truly committed to improving heart disease in women. So I'm excited to announce that we're opening up a new heart and vascular center for women, and that'll be in South Park, and it's opening up in March in just a couple of weeks. I'll be there giving personalized care to women, and it's important for women to know that things like pregnancy and complications from pregnancy like gestational diabetes and hypertension and preeclampsia can really increase your risk of heart disease and death later on.
Good information. And for folks watching at home who might be wanting to make sure that they are staying heart healthy, what are some things that you would recommend in their diet?
Yeah, so the #1 thing I want to emphasize is that 80% of heart disease is preventable. So there's so much that each and every one of us can do to decrease our risk of dying from heart disease. #1 is be sure to get screened. Go to your doctor at least yearly to make sure that you don't have high blood pressure, high cholesterol, or diabetes, because these risk factors can really increase your risk of heart disease, and frequently you don't know that you have it. Another thing is that Novant Health is really committed to improving people's heart health, and so there's a new campaign, Vision 2020, which is out there to motivate people to eat healthy and to exercise, and so that's an important thing. A lot of the risk factors can increase something called our heart age. We may be our actual age, but have a heart that's many years older than we actually are. Research has shown that the average person has a heart that's aged 7 years older than what they actually are. So it's really important to really make some changes to decrease our heart age. And to find out more about Novant Health's Vision 2020, please go to the website at www.novanthealth.org, Vision 2020.
All right, Dr. Charles, thank you so much for being with us.
Thank you.